I think it's our responsibility for those of us in multi-special group medicine to not stand at the sidelines, to get out there, get involved in advocacy. We truly believe that our way of practicing medicine is a better way, that our patients are going to be better off. And if we truly believe that, we need to make sure our voice is heard, and the best way to do that is getting involved in advocacy.
In today's world, none of us can be assured of success. But what we can do is increase the likelihood that we will fulfill our mission to our patients and to our colleagues and to ourselves. I believe we can do all of those things most effectively by working together, and AMGA is the best organization I know which supports those goals.
My personal message to members would be, this is the most important thing we do. There are a lot of tools we provide. We advocate, we educate, and we empower groups to be able to be successful. But at the end of the day, the government is very intrusive in healthcare today, and it's probably the most important thing we do for our members. Keep them informed, get them engaged, let them have a voice in Washington, and move on that voice so we can all be successful together.
Advocacy is just a necessary part of your business. It's a necessary part that you assume as being a leader for your medical group.
Medical groups need to be involved because physicians need to drive the change that's necessary to meet the demands of the triple aim: better care, better health at lower cost. And if we want to maintain our professional autonomy, we have to advocate for ourselves to really make the changes necessary to improve the health and well-being of the populations we serve.
I think there's a fairly wide knowledge gap between the people who set policy and the people who provide care. I think they don't really understand the world of a typical doctor's office practice or a hospital and how it's run. And I think the experts in the field, which are largely the members of AMGA, need to provide the background information so people make informed decisions.
You need your voice heard, and the way to do it is through programs like Capitol Hill Day and meeting with your lawmakers, not just coming down here to DC, but also back in your home district. That's also very important, and you keep the relationships going throughout the year.
I think the way things are going, if we don't get more actively involved, we're going to have decisions made for us that we're not going to really appreciate.
AMGA is respected both on Capitol Hill and with all the federal agencies, in particular CMS. We've been in this town for a long time. We've got a lot of integrity and a lot of credibility with all the agencies.
Because of the time invested by AMGA and its members to build relationships, when things matter, often policymakers will reach out to AMGA.
I think AMGA is probably one of the most respected voices among lawmakers for a couple of reasons. Number one, we represent more physicians than any other medical group or any other advocacy group in the country. So right there, the lawmakers have to listen. It's the true voice of the physicians these days in comparison to other groups. Secondly, the AMGA is advocating a model for change that's better for the patient. That's a message that resonates with lawmakers very well.
In my 7 years of participating in Capitol Hill Day, one of the things that I've found is that lawmakers and their staffs soak up the information. They want to understand better the issue. They want to be educated because they want to make a difference.
AMGA is a very, very impressive organization. It is one that I think is a future voice of American healthcare, not just because where it is today, but where it's been and the opportunity it has for the future.
And I feel like I'm making a difference to advocate for something I believe strongly in, which is something most physicians don't get a chance to do.
We have very unique opportunities to make a difference now. I have never seen the forces come together to create the opportunity for positive change. The opportunity must be grabbed now, and I believe that all of us that are in medical groups and organized systems of care must reach out and take this moment.